In this immersive 360 video, you will gain insight into how a GP practice in the UK operates by following a patient's experience. The patient, Mrs. Thomas, is a 58-year-old woman who lives with her son in a semi-detached house on the outskirts of town. Mrs. Thomas needs to see a general practitioner as she's worried after finding a lump in her breast. This scene is set in the reception area of a GP practice, and Mrs. Thomas is calling for an appointment to see Dr. Kowalski. Patients can book an appointment to see a GP online, by phone, or by visiting the practice.
Lambton Road Practice, how can I help you?
Hello, I'd like to make an appointment to see Dr. Kowalski, please.
Sure. Would you be happy with an appointment in 2 weeks, or would you like to see a doctor urgently?
I'd like to see her tonight if possible, but I won't be back from work until after 6 p.m.
Perfect. Let me just have a look and see if Dr. Kowalski has any appointments during the extended hours surgery tonight. If not, I have access to the local hub appointment system, so we can book you in to see another doctor tonight.
Is there any way I can see Dr. Kowalski tonight?
Let me look. I can see that we've just had a cancellation, so I can book you in tonight about 6:45 p.m.
Oh, that's great. Thank you very much.
My role as the receptionist is vital. It's important for me to find out exactly what the patient wants in order for me to best sort out an appointment for them. It's also important for me as I'm the first person the patient speaks to, and sometimes I'm able to signpost patients to other services that may be of help to them.
Mrs. Thomas arrives at the medical centre and needs to let reception know she's here. In some medical centres, this can be done using self-check-in screens or by speaking to the receptionist. In other medical centres, the patient checks in with the receptionist. Mrs. Thomas waits in the waiting room to be called for her appointment, and the time she waits depends on many things. The doctors will hopefully be running on time, but they may run late if a previous patient needed more time, or if the doctor got held up at a home visit, or if they had to deal with an emergency. This may mean that the patient has plenty of time to read the notices on the waiting room boards, or to watch important health campaigns on the TV if their waiting room has one.
I hate this waiting room. It's where I always start to worry. How do I explain it to the doctor? Will she be able to feel it? Will she think it's cancer?
Doctors call patients into the consulting room in different ways. In some GP practices, the doctor comes out of the consulting room and calls the patient from the waiting area. In others, there is an illuminated sign that tells the patient when it's their turn to see the doctor and which room to go to. When Mrs. Thomas walks in to see Dr. Kowalski, it may be the first time they've met, or she may know the doctor from previous visits, or the doctor may be well known to her whole family, with all of them seeing the same doctor for various issues over many years. Some patients are happy to see a different doctor each time, but others value the continuity of seeing the same doctor and the trust, understanding and confidence that can bring to the relationship. For an urgent problem, the patient is usually offered a same-day appointment with the duty doctor, who is one of the doctors in the practice working on call.
Hello, Mrs. Thomas. I don't think we've met before. I'm Dr. Kowalski. How can I help?
Well, doctor, I'm really worried. I found a breast lump.
Okay, perhaps you could tell me a bit about it first and then we can take a look.
Well, I found the lump in my left breast when I was in the shower, and I'm really worried about it.
Right, well, I'm very glad that you've come to see me about it today. I'd like to ask you a few specific questions, if that is all right.
Yeah.
Has it changed in size?
No, I think it's stayed the same size.
Mm-hmm. And have you had any pain or discomfort?
No, doctor, no pain at all.
Mm-hmm. Any lumps in your breast before or any nipple discharge?
Not that I'm aware of, Doctor.
Okay. Now, I can see from your notes that you have been on hormone replacement therapy for menopausal symptoms and your period stopped over 2 years ago. Have you had any bleeding since?
No, and I stopped taking the HRT a couple of months ago and my symptoms haven't come back.
Okay, that's great. And one final question, Mrs. Thomas. Have you had anybody in your family who has had breast cancer?
Yes. My elder sister had to have an operation to remove her left breast about 5 years ago, and it was because of cancer.
Right. Well, all that information is very helpful, Mrs. Thomas. Now, in order to gather a bit more information about what might be causing the lump, do you mind if I examine both your breasts and your chest? This would involve you undressing from the waist above. I would then examine both your breasts and your chest whilst you're standing and then again lying down. Did you see the sign in the waiting room about chaperoning?
Yes, but I'm not sure what a chaperone is.
Well, a chaperone is an independent person who can be in the room whilst I examine you. Would you feel more comfortable for this examination if you had a chaperone present?
No, thank you, Doctor. I don't think I want anyone else in here with me.
Okay, that's fine. Well, let's just go ahead. So if you wouldn't mind undressing just behind the curtain,
Right.
From the waist above, including removing your bra, and just let me know when you're ready.
Okay.
Okay.
After her examination, it's important for Dr. Kowalski to offer Mrs. Thomas a differential diagnosis and options for ongoing care. All GPs are encouraged to adopt a patient-centred approach and offer the patient information about the different management options and to make a shared management plan tailored to the patient's situation. The doctors can then explain the next steps.
Well, thank you very much for coming to see me, Mrs. Thomas. So, on examining you, I could feel the lump in your left breast. It feels firm and feeling it didn't cause you any pain. So, listening to your history and with the examination findings, one option would be to refer you to the breast clinic for further assessment and tests. I can do that under the NHS 2-week rule, which means you would get a letter from the breast clinic and be seen within 2 weeks. Would you be interested in that service?
Yes, please, Doctor. If you think I should have this lump looked into and there's a risk it might be cancer, I'd really like to be referred.
Well, I do think it would be a good idea to go to the clinic. Could I just check your address and phone number? And would you be available for an appointment within the next 2 weeks?
Yes. Doctor, I've just updated my contact details at reception today.
Ah, right.
And I'm not going away anywhere over the next couple of weeks.
Okay. So some breast lumps aren't cancerous, but I think it is a good idea for you to have some scans and a chat with a specialist.
Right.
So I'll send a referral off today, and you will be hearing from them very soon, either by phone or by post. If you don't hear from them within 10 days, it is very important that you let us know.
Right.
And in the meantime, if you have any concerns about all this, then please do come back and see me.
Okay, thank you.
Okay, thank you for coming to see me, Mrs. Thomas. Bye for now.
I'm so glad she found the lump. I wasn't going mad. I'll just have to wait and see what the clinics say it is. Should I tell Jack? Probably best not to worry him.
As we mentioned before, some general practitioners will form relationships and treat several members of the same family. This can make GP work very rewarding and improves continuity of care for patients and their families. It also helps, as when the GP is caring for an individual, they have an understanding of the family setting and dynamics. This can result in some challenging situations and conversations, such as the one this scene shows, with Mrs. Thomas's son coming in to see Dr. Kowalski with a problem with his ear.
Hello, Jack. I don't think we've met before. I'm Dr. Kowalski. How can I help?
Well, sorry to bother you with this, Doctor, but I woke up this morning with stuff coming out of my ear.
Uh-huh. Have you had a fever or any other symptoms?
Well, I've sort of just not been feeling very well, and my ear's just really painful.
Right, I'll just take a look, if you don't mind. Okay, I'll just check the other one.
I know my mum's been to see you. I'm really quite worried about what she's going through at the moment. Do you think she's going to be okay?
Jack, as a doctor, I can't really discuss if another patient has been to see me or what they have been to see me about. You know, in the same way I wouldn't disclose that you'd come to see me today about your ear. I do have to be careful to maintain patient confidentiality.
Okay.
But it can be difficult when we're concerned about a close family member such as your mum. What are you worried about specifically?
Well, I know that she has an appointment at the clinic, and my auntie had breast cancer. And so we talk about it quite openly in my family. And I'm just really worried that Mum might have breast cancer too.
Okay, that must be very worrying for you. Have you tried to talk to your mum about this? I know it's difficult. You know what you could do? You could volunteer to come along with her to any of the appointments that she has with me, if she would like you to. And then if she writes me a letter or comes to see one of us to tell us that she's happy for us to discuss her medical history with you, then of course we will be happy to talk to you about your mum and what's wrong.
Okay. Yeah, you're right. I'll try. I mean, I know she wouldn't mind, so I'll talk to her about it and about coming along with her too. I mean, she might think it's a little embarrassing. I'll see. Okay.
Now back to your problem. On examining your ears, I can see you've got an infection in your left ear, which would explain the pain and the discharge. You say you're feeling unwell. You could try paracetamol, because normally these things do improve within 3 days.
Oh, okay.
Because there is a lot of discharge, I can also offer you a delayed antibiotic script, which I'll send electronically to the pharmacy. So you don't need antibiotics immediately. But if your symptoms don't improve within 3 days, you can take them. Is that okay?
Okay, yeah. I was hoping you'd give me antibiotics because I've just, not been feeling well. But yeah, I will wait 3 days before thinking about taking them because I've heard that it's not good to take antibiotics unless you really need them.
Yes, that's right. And if your symptoms don't improve or you feel a lot worse, or if you take the antibiotics and they don't work, then do come back and see me, or you can always call 111 if the practice is closed.
Okay.
And Jack, do have a think about what I said about talking to your mum, won't you?
Yes.
Get in touch about that as well if you need to.
Okay. Thank you, Doctor, I will.
Okay, thank you.
Fair enough about the doctor not being able to talk to me about my mum. Seems a bit over the top though. I know she's got an appointment at the clinic, but I just kind of wanted to know what she thought it was.
It can be really difficult when a patient asks about a family member and their treatment, because I know that I need to stick to the GMC confidentiality guidance. It's very central to what we do. But equally, it's important to listen to the patient, to their concerns, and give them some options. For instance, I suggested to Jack that perhaps he could talk to his mum about the situation.
Jack walks to the pharmacy to collect his antibiotics. Some practices have a pharmacy within their premises, and others have links with a local pharmacy. Some practices email the prescription scripts to the pharmacy direct. Others print them out and give them to the patient.
Hey, so my GP told me to get some antibiotics if I wasn't feeling better and my ear carried on hurting. She said she sent you the prescription directly a few days ago.
Okay, let me check. It'll be about 10 minutes.
Okay, thanks.
Is it Jack Thomas?
Yes.
Could you confirm the address, please?
63 Long Acres, Greenford.
Okay, great. The antibiotics that the doctor prescribed, you should take one 3 times a day for a 5-day course. Have you got any allergies at all? Penicillin or anything? Inside the bottle there's a leaflet. It explains to you some side effects you might get, like indigestion. So just give it a read, it'll be useful. That's for you. Do you pay for your medication at all?
Yeah, I think so.
Okay, great. If you just tap on there. Thank you very much.
Great. Thank you.
Cheers.
GP practices have access to a range of multidisciplinary team members. These include nurses, pharmacists, physiotherapists, dietitians, and hospital consultants. Mrs. Thomas has been asked by the doctor to go and see the practice nurse if she has issues with her wound. She'd already met the practice nurse when she previously organised her travel vaccinations for a holiday, and when she'd taken her son for his immunisations many years ago.
Good morning, Mrs. Thomas. I hope you're keeping well. I was just having a quick look at your notes and I see that you had a mastectomy about 10 days ago. How are you doing?
Well, I'm feeling a bit better than I was. It was really tough at the beginning and I was so tired. Yesterday, my son took me out for lunch. I do feel a bit self-conscious, but it was nice to get out.
We'll talk about that in a moment, but first, what can I do to help you today?
Well, Dr. Kowalski told me to come and see you if I have any problems with my wound, and the corner of it doesn't seem to be healing very well and it's oozing a bit, so I need to keep the dressing on it. So I wondered, can you have a look and see what you think?
Of course I will, but how often are you having to change the dressing?
Well, I've started having a shower, so I change it after that every day. I don't like doing it, and the scar doesn't look very good. And the thing is, I don't know what to wear, and I feel as if everyone's looking at my chest. It looks so different.
Lots of ladies after having a mastectomy feel exactly the same as you do. You're doing really well, don't forget that. Have you heard of the Macmillan nurses? Because I think they can offer you and the family lots of help, advice and support.
Yeah, I've heard of them, but I haven't used them at all.
Well, let me go and find a leaflet. It will have their phone number in. Give them a call and make an appointment.
Okay, yes, I'll call them.
Also, did you go to the cancer centre? It's next to the hospital.
Yes, I did pop in there before the operation, but I haven't been back since. But they mentioned that they do lots of lovely things. I think my son would be really happy to know that I was getting some more support because he's been really worried about me.
I'm sure he would, but we'll have a look at your wound now and see what we can do to help.
Thank you.